Okay, Dr. Rachel Hollander, thank you for being here on our Coursera course. I'm so glad that you're here. Uh, but you had, as a physician, had a very painful episode with chronic pain, isn't that right?
Yeah, about 8 or so years ago, when I was in my first full-time job as a physician after all my training, um, and I had a full panel of patients. Um, I was a year into this job, and I started to have finger pain when I used the computer at work, and wrist pain, and forearm pain.
Hmm.
And eventually it went up into my upper arms, and it was like a tingling and burning and aching.
Wow. And did it start in one hand and one arm or both or?
It started, I think, my mousing hand, and then eventually it would be the left hand also, the other hand. I even tried to switch hands on the mouse.
Sure, sure. And was there any reason? Did you injure yourself or something? Or you're just doing usual like work, being a doctor and typing and all that kind of stuff?
So, yeah, I just thought, I was working really fast as a doctor, doing a lot of typing, including as you learn in training, you have to type in the room when the patient is there. You will never get your stuff done.
Right.
So I was just kind of madly always like this on the computer, whether I was with the patient or then out at my desk later.
Yeah. And I'm sure you tried different things, ergonomics, different mouses, different hand, as you said. You tried to rest. Did any of that help or what happened? Did it just start getting worse? I mean, it sounds horrible.
Yeah, so it got to the point that I tried workers' comp. I'm not sure I quite would have thought of that, except that a workers' comp doctor in our system worked not even just down the hall, like a desk away.
Wow.
So I saw her and she thought, I just honestly didn't have any thought in my mind. I just knew I was hurting and I needed less typing. But she thought, oh, carpal tunnel. And I learned voice recognition software
Hmm.
to dictate all my computer stuff and auto click software so that I didn't have to click the mouse. I would just hover, and after a second delay, it would click for me. So that helped, and I did hand therapy. Um, that didn't help a ton, but I had close attention with someone who seemed to care. And
Yeah.
what really helped though at the time was my husband said, "Oh, I know one or two other people, guys who have kind of a slight body physique like you, and they strengthened, they lifted weights, and that helped a lot." And at first I was really against it because I thought that would just hurt more to lift weights, and I only lifted 3 pound weights. But I did that. I did a class at the gym where they play fun dance music and you're in a group, and that really helped over just kind of immediate over days.
Hmm. So you had some relief a bit, but was there anything? I mean, you examined your hands, you had doctors examine your hands. Was there anything wrong with them that they could find, objectively speaking, or did they just kind of look normal?
I did have a little weakness. I mean, you could call that objective when they use whatever measurement
Yeah.
device that is to check weakness. But otherwise, they looked fine. There was no atrophy or loss of muscle. The color was normal. The pulses were normal. I could move it in all directions.
But you had this tingling, burning, aching pain in both arms that went all the way up to the arms. Was that pain coming and going, or was it kind of there all the time, or only when you moved?
So it was especially when I was at work, or doing work at home. But definitely it was better if I was on vacation.
Really? Tell me about that.
Yeah, if I was away from work completely, it would be fine for the
Wow.
most part, unless I was dwelling on it, thinking about work or worried about work coming up, having to go back to work.
So you found that you were having pain even when you weren't working, like you were around the house, right? Or you were doing things, cooking, things like that. You were having pain. And then you went on vacation and it completely went away. And then it would come back when you thought about it or worried or had stressful thoughts. I mean, that is an amazing, those things are amazing. And to me, that's just obvious. Anybody who's taking this course now will know that, oh, these are signs of a mind body condition, but yet you were a doctor and you had doctors helping you, and nobody could figure that out. Is that what you're saying? Nobody could understand that? Why
Yeah.
it's going on?
And it's so embarrassing now too that I couldn't figure this out. We in medical school, you really learn structural physical things as completely separate things than psychological things. And, we all, of course, acknowledge the mind affects the body, stress impacts our health, but we don't put together how directly related they are and how you can have something be so painful or some other type of symptom so evident that you feel and there's not anything structurally wrong.
Wow. And then you had some relief with some kind of weightlifting and things like that. But then you had to keep going. You kept working. You couldn't be on vacation all the time. Did it get worse over time? Is that what happened?
Yeah, so over the years, it was about 6 or slightly more years that I kept dealing with it, but I went down and down on my work hours, eventually to half time. Originally, full time was for me like I was working 60 hours a week, and half time was about 35 hours a week. Um, and I could kind of manage it, but it's still just every few months I would have a flare up and it would take vacation or I didn't always know what for it to get better.
Hmm.
Um, so yeah, I went down and down until 2 years ago almost, I was deciding I should move away from an expensive area in California to be closer to family. And that was just a stressful thing to think about because I really liked where I lived. But just the thought of telling my patients that I would be leaving was really stressful for me because, nowhere in the country is there enough doctors. And then I contemplated that every 20 minutes with a patient visit, the whole visit would be about how I'm leaving.
Hmm.
Um, and I only put this together later that was a big part of why I had to leave work suddenly because of the pain flaring up.
So
I couldn't understand at the time why.
you had much more pain, and it wasn't related to more activity with your hands. It was related to more stress with thinking about leaving, talking to your patients, and feeling uncomfortable and stressed and kind of trapped in some ways. And that caused a major flare up in pain, but you didn't realize that that was the cause, obviously, at that time, and your doctors didn't realize it. You were still seeking medical care, and but here you are now getting worse and worse. And what it all came to a head, it sounds like.
Yeah, and so at that point, as I said, I left suddenly and I never went back to work, which was really distressing to not say goodbye to colleagues, to patients, to anybody. And it felt like a real weak thing. Like here I'm a responsible person and I just left. And then I also didn't know if I could work in any job ever again, if, let alone being a doctor. And so that was very distressing. So even after I left work and left using a computer in any fashion, my pain was only worse and
Was
my
worse.
dysfunction was only worse.
Was worse. Wow. So it's obviously, in retrospect, it wasn't related to typing. It wasn't related to using your hands. It was related to something else. And did you get any other symptoms along the way as well, in addition to the hand and arm pain that was kind of coming and going and then finally getting worse and worse? Did you have anything else?
Yeah. Yeah, with all the distress of what would I do for a living, if anything, and just like, it becomes your identity to be a doctor and to think you can't ever do that again. I got heart palpitations
Mm.
And I didn't really get that checked out until and I listened to my heart with my stethoscope and just kind of was obsessing about it. But, I didn't really do anything about it for a few months until I passed out. And I went to the emergency room and they
Wow.
found I had extra beats that are not harmful, but really present.
Sure.
I had a stress, not stress test, a heart ultrasound to see the structure and function of my heart. All that was normal. And I had a bunch of labs and chest x-ray. So, I found out that there was nothing seriously structurally wrong.
Mm.
I also, over this time period, had what's called a globus sensation, which I didn't really think about it in that with that
Yeah.
term, because that term kind of to any doctor signifies something psychological. I just thought I can't swallow right. I can't eat. I have to clear my throat. I can't get food down. And so I lost more than 10 pounds in weight.
Wow.
So that was really distressing. And I had an upper endoscopy to look in my esophagus to see if there was some
Sure.
growth, and there was nothing. But just knowing the next day that test was normal, I could eat again.
Wow. So you could see how things could actually get better, get worse, and you began somehow, and then you ended up stopping working as a doctor. And then what kind of led to your understanding of changing your understanding of this or how to get better? What led to that?
So I met someone completely unrelated to healthcare, a new acquaintance, and I was introducing myself and, saying, "Oh, yes, I was a doctor, but I'm not working right now. I had this repetitive motion problem, arm pain." And I just kind of kept it pretty concise. And she said, I had back pain for a long time. And I don't know if you've heard of Dr. John Sarno, but his ideas really helped me. She wasn't pushy about it. She just kind of planted the seed.
Hmm.
And sometimes I think if it was earlier that I had met her, I wouldn't have taken to the idea. But because at this point I had seen 15 different or more different medical providers, and it was almost a year after I left work completely, um, I was kind of open to learning about that. So I looked online about him, and then I found your Unlearn Your Pain website and watched the videos. And just after watching the 4 free 15-minute videos, my pain was 80% gone the next day. I could
Wow.
move my arms, I could lift dishes again, I could do everything. And then after 3 weeks of reminding myself that I was structurally normal, I was 100% fine.
Wow. That's incredible. And you were actually considering having surgery at one point, right?
Yeah, I had set up appointments for consultation with different surgeons around the country after I did have an MRI, incidentally, showing that I had what's called thoracic outlet syndrome, with a really narrowed space between my collarbone and my first rib where the nerve comes out. So I believed I was really structurally defective and I needed surgical help.
And your life really had been totally turned upside down with this pain. Not only being eventually being unable to work after 6 or 7 years of that, but being unable, even when you weren't working, being unable to cook and clean and wash dishes and live your life. I mean, it's astounding. And people would think like, well, if there was nothing wrong, how could the pain be so severe? How could the symptoms be so severe? Not only the pain, but difficulty swallowing and the heart palpitations. But yet,
Mhm.
these are real phenomenon that, are not imaginary. It's not all in your head. It's your brain, but it's your brain producing these things that are very real and obviously very severe. I mean, our hearts just go out to you with somebody who has been through so much of this. When you think about it and looking back at it, what do you think was the stresses that were causing this in the first place? You were a young doctor at the time, right?
Yeah, there was some isolation there. You know, I had left a training program where there was a lot of camaraderie and it was kind of like a school environment where you're with a bunch of other trainees and you go out and you have a bunch of other people you know. And then I would and then I was in this job where you're just alone. There's no one to touch base with. You're just a practicing doctor working autonomously. You rarely, if ever, see colleagues. The closest person you're with is your medical assistant. But you know, you just feel like you're in the trenches working.
Then working really hard, long hours, a lot of typing, even though it's not the actual typing that turned out was causing your pain, but that was where your brain chose to give you pain as a message that maybe typing was dangerous, or maybe being a doctor was dangerous, maybe too many patients, um, too much pressure. I mean, when I started my internship, my first year as a doctor, I had diarrhea for 6 months, and my brain was, I was afraid, I was afraid of making a mistake. I was afraid of harming somebody. I was afraid of being exposed as not knowing what I was doing. And again, I think in a lot of sense, feeling alone, you know. Um,
Mhm.
and so has your recovery stuck? I mean, it was really quick, getting better in really a short time. Did some of the symptoms kind of rise up again a little bit later? Or?
Yeah, so I did return to some level of typing um, a few months after the symptoms went away. And again, the symptoms were still there even after I hadn't been typing for a month. So, um, it was a real change. But when I did start typing again, I gradually noticed the problem, even though I haven't returned to work still yet.
Mhm.
I was typing for myself, basically
Sure.
kind of like journal thoughts on the computer. And I wanted to get a sense if I could type again and how that would work. But you gave me some good ideas to correlate using a computer with positive messages. Um, and it's helping. I still do have some sensations, but I do a lot of retraining still.
Yeah, it takes time to retrain the brain out of this. Sometimes people, it happens really quickly, but oftentimes it takes several months. So I wouldn't be surprised if it takes several months of, like I always say, if pain can be learned, it can be unlearned. But it's kind of like a habit, and frequently habits take a while to reverse. So you're on this path, and we're hoping that you can figure out a way to work again, or figure out what's going to be the best path for you.
Yeah, I'm looking forward to new ideas and how to practice and help people in ways that I couldn't help them before because I didn't understand this paradigm of pain.
And couldn't you actually even help yourself?
Yeah,
Physician
exactly.
heal thyself, right?
Hmm.
Well, Rachel Hollander, thank you so much for talking with us. It's a pleasure to talk with you, and I'm glad you're on the path toward recovery and revitalization of your life.
Thank you.